Yeah, we have a few different IVs. I've developed one specifically recently for the Times called the Immune Support IV, and that's getting good results. It has vitamin C and extra selenium and N-acetylcysteine. It also has B complex and B12, extra B12. So, and it's way more vitamin C than you can take orally. So your cells are really very much bathed in vitamin C, and also zinc is there. So it's a big boost for the immune system. Also, it gives people an energy boost as well. So that's the immune support. And then I do a high-dose vitamin C IV, and I typically use this one for patients who come to me who've had chronic infections. So we all have heard about Lyme disease and how it becomes a chronic infection, that people seem to always fight Lyme. Also Epstein-Barr or mono, shingles, herpes, those you might have heard of. And so any kind of a chronic virus, I can test for these too if we're not sure which one we're looking at. We'll do a high-dose vitamin C IV, and we'll do a series of them, and what it does is it suppresses the viral count and allows the body to, the immune system to kind of catch up and get on top of it. So it could take 1 to 10 of those IVs to really turn a person around. And typically the presentation, the patient comes to me complaining about chronic fatigue. It's a severe level of fatigue with a couple other symptoms that let me know that it's infection-oriented. And we have another one called the Myers cocktail, and that's a standard, and a lot of people are doing that one, but it does work well, and it has great research with fibromyalgia patients that shows after 10 IVs they had an increased quality of life, a lot more energy, and less pain. So I use those, and then we've developed recently a very short IV, push, we call it the push, and it only takes 10 minutes. So it's an IV with a high dose of vitamin C and other nutrients that is just a real quick one for you.